Like that quickly, a big mark came out. I mean, it was like 6, 7 swipes. All right, I'm done.
So about 2+ years ago, I had an MRI. There was a little bit of degeneration and narrowing of the facet joints,
Okay.
and that's where they kind of saw most of the issue. I had a steroid and bupivacaine injection to kind of diagnose if that was the issue, and for like 2 days afterwards, I mean, perfect. But then it came right back, obviously.
After just 2 days.
Yeah, after maybe it lasted about 2-3 days. But so the steroid did nothing, but the anesthetic helped out.
Okay.
So that's definitely the spot.
Okay, and has it been consistently going down the right leg for the last 2 years?
Yeah.
Okay, and where exactly does it go?
So all the way down the back, all the way to the ankle.
To the
Kinda
heel?
stops at kind of stops about here.
Okay. I think more than any other profession, I believe that dentists or anybody that works on teeth is one step from being a chiropractor, because almost everything directly translates. The most important structure in the mouth, the enamel, doesn't regenerate, doesn't regrow. You don't have enamel that rebuild enamel. Once your enamel is worn out, it's over. That's it. So in a very similar fashion, what you know about the enamel needs to be translated to these discs. They're the exact same thing. They have no feeling. They're made of 70-80% water. They don't regenerate, and they're a produced substance, and we get one set of them, just like our one set of adult teeth. Once we wear them out. Primarily, we see a pattern which nobody's really talking about. I don't see any billboards letting us know what I'm about to tell you, which is that cervical 5, 6, and 7 in the lower neck account for 99% of neck surgery, and lumbar 4 and 5 account for 99% of lumbar surgery. They went in here and they injected, painkillers essentially into his lower back to try to numb these nerves, and they gave him some relief. But if I get punched in my face swells up. The only way for my face not to be swollen is to stop being punched in the face.
Right.
There is something causing the inflammation and damage in this area that a shot won't alleviate. The alignment is causing all the stress to go down to your lower back, and that's what we want to address is why is this area inflamed, instead of just keep on injecting cortisone shots in my face when in fact I'm keep on getting punched. The inflammation that's here is a result of hypermobility, too much mechanical pivoting, like a piece of paper bending back and forth in the same crease, it's starting to tear. So we want to create a new folding point, and at the end of your visit, start working on aiming your spine back to that curved position.
Half the time we're looking upside down and things like that, right? So I'm rotated also, and even as I rotate right there, I feel that pain right in that area.
Yeah, when you turn left, you're jamming these joints.
Yep.
These joints are being jammed, so it's facet syndrome, right side. All right, we got a little bit of heads over to your right side. Your left, I'm exaggerating a little bit, but we got a left high shoulder and the head's over to the right. Your body will subconsciously drift away from a problem. If I break my right ankle, I'm going to stand like this, right? Why are you standing crooked? Well, it's because I have an injury over here that made me tilt away from it. So there's something over here that's making your head, let's go over here. Left hip is high. Again, this is hurting, and so your body intelligently and purposefully is raising your left hip. Do you see that, right?
Okay.
When you lift your left hip up, it takes stress off this. This is hurting, so your body's trying to essentially do this. You're tilting to the left, which is what the left hip elevation does. It opens this up to try to take pressure off that tooth, essentially, in here.
Sure.
This gets very silly and stupid very quick. My left hip is now high, and a chiropractor will say, okay, your left hip's elevated, let's take your left hip and push it back down, right? To try to straighten out the hips. Then that throws the weight right back on the injured area, therefore hurting the patient, in my opinion. The body intelligently lifted it. Or somebody says your left leg's short, let's give you a heel lift, right? You put something in your shoe on your left side because your left leg is shorter. All of that is silly, in my opinion. How do we get the hips level? We take stress off the lower back by putting it back on your middle upper back. When this no longer hurts, your body will automatically lower the hip. Your body is doing it not to annoy you.
Sure.
The hips aren't crooked. It's an alleviation, or what we call a compensation. So you remove the reason for why it's compensating. If you want a quiet visit, cost double. Head's about 1 inch forward. Head weighs about 10 pounds. Every inch the head goes forward, the muscles do double the workload. The discs are under double the amount of interdiscal pressure. Take a deep breath in for me, a little sip. And then breathe in, let all the air out. Exhale. Already moving, okay. Yeah, deep breath in, I got you. Head back, exhale. Let it go. Yeah. Way too tight right there, yeah, I got you. Breathing deep. Exhale. Chin down. Keep going. Yeah, stay. Yeah. If that moved beautifully, I'd be confused, right?
Okay.
That is the problem. The rigidity of your chest. Ed, I'm not sure if I like that kind of adjustment. I understand. If it was that stiff on me, I wouldn't want that to be pushed on either. Essentially, when you bend to put your shoes on, you don't get to decide which bone moves. The loosest bone moves first. And I just put 150 to 200 pounds of force into your middle back vertebrae. Like I put like a piano key. I pushed the piano key, it didn't bend. The key didn't go down. Now we're going to massage and we're going to unlock that for you. But the rigidity here is why.
Okay. Now, 4 or 5 years ago, prior to all this happening, I used to get really tight spasms in my upper left back, right where you were pushing. But then that kind of went away and transitioned into this.
Yes.
Is that
you got
lead into it then? So that's
what, 4 or 5 years ago?
Yeah.
And what was going on? What were you doing? Any type of activities? Just
starting to work 12-hour days.
Just more work,
Yeah.
more sitting.
Yeah.
That was your middle back shutting down. That's the cause.
Yeah.
It went away because the sensors are all based on motion. So the fact that you felt something up there means that it was still moving. Then at some point it just quit. And then you're like, oh, it went away. My spasm, they didn't go away. It just became frozen.
Okay.
So like I was saying earlier, this is where all surgery happens. No chiropractor should ever touch your lower back. I would hope the rest of your life, I'm just letting you know, nobody's allowed to put their hand here and go pushing. The goal of this adjustment is to adjust the area below the sacroiliac joint, below your L5, and the middle back above. But I'm going to do as best I can to leave this alone. Take a deep breath in. I got you. You're not going to fall, I promise. I won't hurt you. Exhale. Good. Yeah, deep breath in. I got you. Exhale. Yeah, other side for me. Okay, other side.
I do get massages regularly.
Yeah.
And a lot of times after she's done working on my back for a while, I have a hard time flipping over because the pain is so bad, almost like immobilized.
When you're on your back or on your stomach?
When I'm on my stomach and
Correct.
she's working on my back.
Yes, sir.
In order to flip
Correct.
over,
Yes, sir.
I have a really hard time
Correct.
up there.
That's just the joint. What's happening is, I'll explain. It's a good question. What's happening is, these joints are so inflamed down here. When you go into extension, the joints overlap like a handshake. You understand? They completely overlap. We have a lot of stability here. When you bend forward, they separate. The joints are loaded with pain fibers. This is why old people are all hunched forward. They got all the weight off the joint, okay? But if all the weight's off the joint, all the weight's on the disc, which means you're going to rupture out those discs. So we have to get the weight off the disc, but the weight's got to go somewhere. It's got to go back on the joint. That's what you're feeling. When you lay on your belly, you're compressing those joints, which then the more you relax into it, now you got the joints more closed than they've ever been, right? And now you're going to try to put weight on them, and they're going, whoa, hold on a minute. We've never been this compressed, and we're loaded with pain fibers. So what you need to do, and to absolve that, well, until the joints calm down, what you need to do, and what we'll do in a minute, you need to, when you're being on your belly for a few minutes, you need to flip onto your back, roll to your back, let it open up a little bit for about 1 to 2 minutes, and that will not happen. It'll go away. You need to maybe even bend your knees. In order to actually start to put 100 pounds of weight on that joint, you got to open the joint a little bit, which I don't like and shouldn't be necessary, but you'll need to do until you've calmed down how pissed off these joints are. Okay?
That makes sense.
So we actually have to open them, which means we're putting weight back on the disc. I don't like it, but yeah, if when you're laying on your belly, you're getting up with a nice curve in your back.
Right.
But these joints, and I can't hardly, I'm freaking stuck here. It's feeling really weird. That's just the joint screaming at you. Nobody really has surgery on joints, but they're loaded with pain fibers, and I'm dying here, Ed. And just a couple little, you'll see, some chiropractors bring the knee up real high. You'll see guys bringing the knee up. This flattens out that curve that I told you we need to have. Purposefully, when we're doing this, you'll see me trying to keep some sway in your back.
Okay.
The goal of any adjustment is to adjust you into the position I want to aim your spine towards. You understand? I don't want to be taking the curve out of your back when I'm adjusting you, right? We want to be inducing some curve when I'm adjusting you, even though adjustments don't change posture. We still want to aim you in the right direction so that the stretching is more effective. Okay. That took chiropractors 100 years to realize that adjustments don't change our alignment. There we go. I got you. Good. All right, breathe. I got you. Exhale. All right, it's okay. Yeah, that's enough. Face up. You are so loose at L5 that when I was trying to adjust this joint, and this guy's moving all over the place.
Okay.
I'd almost say you shouldn't even have that. Like if I saw you again, I wouldn't even do that for 5 or 8 visits because you're so loose here.
Okay.
That I'm not able to adjust the joint that I want adjusted without moving the joints that I don't want adjusted. There we go. Okay. Oh, we're starting the right side. Real easy. I got you. Yeah. A little tight up there. I don't expect that to be the most easy thing. There is some stiffness up there, and we gotta loosen that up. Very easy. I got you. Same thing. Real gentle. I got you. Chin up. Okay. A little bit deeper. I got you. Okay. All right. I got you. Muscles are pawns on the chessboard. Just because there's a lot of them doesn't make them the most important pieces. You know, the most important structures that are going to define your life when you're 70 are the discs, the nerves, the joints. Does that make sense? Sure. Muscles, schmuscles. You know, they're not going to be the end problem. Every back surgery that's ever done, spinal surgery, is because a disc is injured. No one's getting back surgery because there's a muscle.
Sure.
It's because you got a nerve hit by a bone spur. Well, no, doctor, it's a bone spur. Well, the bone spur would have never reached the nerve if the disc was still healthy. The bone spur still is irrelevant. It's still based on the disc. This is why we call it the natural cervical curve. It's natural because you can't stop its formation in the first year of life. Every child from birth to about a year will develop their own 45-degree natural cervical curve. It's secondary because it's not that it's less important, but it's there. It's created after birth, right? We're born with just the thoracic primary curvature because we're born with it. The neck is, the cervical and lumbar lordotic curves are secondary because they form after birth. You get your lumbar curve by crawling, and you get your neck curve by holding up your head. And by a year old, you have perfect alignment. And then at school, at 5 to 20, we lose it. And no one cares. And we lose the right alignment. Then we go live our lives in the wrong alignment. And hence why I have a job. And we don't have any orthodontists. You know, I actually could be wrong about this, but I was told at 12 I had an overbite. And the overbite was going to wear out my bottom teeth. Maybe that could be correct or not, you can tell me. But he said my top teeth are overlapping my bottom teeth more than they should.
Sure, yeah.
And so he said the bottom teeth were going to get more stress on them. And that by, I don't know, it was Dr. Winkler here in Sarasota, he said by 30, 40, they're going to be, pretty worn out. And so we're going to spend 2 years and $5,000 and we're going to move your teeth to a better position.
Sure.
And he didn't say he believed that it would happen. He didn't say, I think it will happen. He said, this will happen. This alignment will cause this problem, and we're going to head it off now. And it's the same thing with the alignment of our spine. When we lose the curve in our spine, certain vertebrae, certain discs are going to age at a faster rate. Not possibly, not maybe. You will have them be overstressed, and our world is simply reacting to the problem. There is no preventative health care of, let's see where your alignment is and try to head it off. So what took chiropractors 100 years is to realize that stretching is what changes posture. They were selling an idea that adjustments can do it. And while adjustments are necessary to unlock the spine, to make it limber, they don't change the position permanently. We have to stretch and mold and hold your neck in a curved position for about 20 minutes for it to start restoring that curve. We unlock the spine, we massage the spine to make it limber, but the goal is to restore the curve through stretching. Same thing with your lumbar, the same process.
So then do you feel or believe that physical therapy is important to develop a balance of the muscles afterwards, or?
Muscles respond to problems.
Okay.
They're not really, Person gets a whiplash, the muscles get tight to protect an injured joint, right? They are reacting to a joint or a nerve getting injured. They can give stability, but it's not their job to give stability. So we've acted as if muscles are designed to give stability to the spine, when in fact they're not really. When you were putting your hand on my back, you didn't feel tight muscles when I was upright.
Right.
Right? They're not supposed to be contracted all the time. Now, if I have an injury, my body will tighten a muscle to protect an area in anticipation of another injury. But again, that's a compensation to having an injury. It's not the job of muscles to be tight. Now, if you're crooked, they'll be tight because you're crooked. So just don't be crooked. Do you see my point? It's because there's something that now they're doing that. So
Sure.
They've taken a backup function that a muscle can provide in an extenuating circumstance and said that's its job, and that bothers me. It's not. Muscles build up lactic acid. The more you contract the muscle, the more acidity is going to be, how much soreness you're going to have, gingivitis. I want your back to be clean, mobile, in the right alignment, and muscles be tight when they need to be tight. You understand? It's not core strengthening. It's not the job of your core. Now, if you're a boxer, then yes, you need to have a tight core to be able to take an abdominal punch. Hopefully you and I are getting punched in the abdomen that time.
Right.
But if you're getting punched all the time, then yeah, I guess you need a tight core. I just don't get punched often. Please don't let anybody punch me. I'm just saying. The mark comes out where there's gingivitis, where there's inflammation trapped inside. You'll see a little mark up here. I'm not going too crazy, but there's some marks on both sides of your upper neck. This is evidence of the stiffness that's in here that then makes the lower neck overwork. When the lower neck overworks, your head goes forward, your middle back gets tight, and the dominoes go down to your feet. Your left side's more elevated, about at least a half inch, quarter inch higher than your right. If I put a marble, it's going to roll off to your right side.
Okay.
This elevation here is again tied with your left hip being high. The tightness of this area is going to cause right lower hypermobility because you have left middle stiffness. Okay. The tightest part of your back.
Yep. Well, that's exactly where I would get those sharp pains.
Correct.
Where I get the spasms right there.
This is the cause.
Yep.
You got it. You actually knew the cause. The cause is here. This being locked is now throwing all the work down to your right lower. And so the trick is going to be, I'm going to teach you at home how to actually emulate what I'm doing here to encourage and restore function. Yeah, I mean, gee whiz, bud, that's real crunchy. It's wound up, tangled like headphone cables. It's all knotted up here. It's like hairstylists and dentists, or the dental hygienists. They're all probably easily the toughest job, because one thing is, some other jobs might have bad positions, but you can take a break. But when you're in somebody's mouth, you got to finish the job.
Right.
You can't go lay down for 30 minutes and, oh, my back's hurting. You mind if I take a break for, you got to finish the work.
Right. And it's just one after another after another after another. So
it's abuse. That's called abuse. When your body tells you to stop, and you have to say, shut up, body. Your body's going to say, okay, fine. I'll get you back for that. And this up here is the cause. Hopefully nobody touches your lower back. No massage on the lower back.
Okay.
Leave that alone.
Okay.
It's like having a cut on your skin and somebody's digging their finger into a cut. All they're going to do is rip it open more and further injure it. You have to look at the ligaments that wrap the facet have been torn. That's what a sprained joint is the actual rubber bands that hold the joint together. Kind of like a piece of fabric that's got a hole, and then it gets patched. And then if you pull on that fabric, where is it going to tear? It's going to tear right where the patch is. And so your body continually tears in the same spots, and that's how scars grow. And leave it alone. All right. Okay. All right. My goal is to go to the edge and back off. My goal is to go to the edge where you're about ready to throw up, and then if you're wondering what do you want, Ed, I'm gonna go right to what is your limit, and then we try to back off.
Yeah, I mean, this is fine.
Okay, you're doing okay.
Every time, whenever I get massage, it's always good. I always like it hard.
All right, good.
So that's no problem.
All right, perfect. Very interesting as a profession. We started off very zoomed in, and then over time we zoomed out. Most professions start off zoomed out and they
Mhm.
end up zoomed in. So the current orthodontic type of chiropractic is zoom out, and that's why at the beginning of your visit I looked at your whole body posture, right? I didn't look at segmental posture, right? I didn't look at the position of T6 over T7.
Sure.
I looked at your head over your shoulders. We call it global postural analysis versus segmental postural analysis. They found that if you fix the global postural problems, there is no segmental postural. Those are all results of injuries from the global posture not being correct. Anyway. Don't you need a set of x-rays to work on them? No. I don't need a set of x-rays to work on them because I'm not here to adjust his subluxations. My job is to work on what's fixated to make his spine work as a team so we can actually mold the global postural problems back into the right position. A lot smoother, you know, it's a lot more smooth over here.
Mhm.
I got a bunch of bumps on this left side. I'm going back to left in a second, but I'm not gonna spend as much time.
Yeah, like a lot of times if I am laying on my stomach, what I find is if I put a pillow or something underneath,
Yes.
that actually takes the pain or pressure
Well,
off.
You can
So,
do this.
I mean, I don't need it, but
See, this is what I do. This is good for you.
okay.
This is good to have this elevated, but we're gonna have to lay on your back real quick. You're saying
Okay.
you got the roll to your, this is the normal curve.
Okay.
But I don't want, what's happening is you're bending too much here and this is stiff.
Mm.
So I do want this, assuming that it's bending evenly. I'm not
Okay.
confident that you're bending evenly.
Okay. Because yeah, this position
Uh-huh.
is what sort
Sure.
of what I do with the pillow, and it definitely takes
Yeah.
pain away.
Yes, sir. It's
So,
good. You're
that makes
you just
sense.
got, but the facets just got to get used to it.
Got
They're
it.
just,
So this is how you want it, basically.
Yes.
Okay.
yes, but
And it's going the other way to compensate.
Correct.
Basically.
yep,
Okay.
this is
Okay.
absolutely atrocious.
Yeah. Well, I mean, that was the spot forever before the lower back started. So
Jeez.
it's interesting
It's
to me here. Yeah.
it's the opposite, right?
Mhm.
This is the hypermobile. This is the least mobile.
Okay.
It's the opposite, and because it's so immobilized on MRI and X-ray, it'll be actually the youngest part of your spine. It's
Mm. That
in
makes
the
sense.
medical world we'll call it unremarkable, and it's not unremarkable that part of your spine isn't aging.
Right.
That's actually remarkable that this still looks young. Why is there no evidence of aging right here? Well, it doesn't function. He's not chewing on these teeth,
Mm.
and he's only chewing at the bottom, and he's grinding those teeth down to a nub. Remember who you are. You know, the Lion King, there it is. Trying to get this part of his back to remember how to function. Like that quickly, a big mark came out. The eventual goal, the eventual care will be, I can't make a mark on you even if I wanted to, that the tissue is actually clean. You can't make plaque appear. You only can clean off the plaque that's there. I can't make the gua sha appear. It only happens because there's something inside that's trapped, and then I can clean it off. That's what this mark is. This is cellular exhaust, waste, inflammation. The nerves have to travel through this tissue. Now again, because it's immobilized, you don't necessarily feel it, but you will as we start to unlock it. You might go, Ed, this hurts, and now this is hurting. What the heck? Now I hurt in 2 places. And then this is gonna hurt more. This will go away.
Mhm.
And the last battle we're actually gonna fight, visit 8 through 10, is up here.
Okay.
This is all gonna go away, and then, you know, the end game of your care is gonna be, Ed, my middle back is still killing me. Because
Okay.
it's gonna be the most reluctant or resistant to doing what it's supposed to be doing. I mean,
Mhm.
it's just pouring out of here, buddy. A lot of plaque.
That's good. That'll make
Yep.
a good video.
Yep. Yeah, there it is. Like, was this just a mole? What was that?
I don't know what that one was. Most of them were moles that were removed. The most recent one was just a biopsy of, I think it's just a lipoma.
The internal drainage, lymphatic drainage is based on mobility. So what happens is when your body can't drain things internally because
Mhm.
it's tight, the body starts to sequester and wrap it up in presence. Do you understand? And the mobility of your chest is, to me, the reasons for lipomas. The tightness up here is the cause of that. We don't have a heart that pumps our lymphatics. I have a question for God when I get there, but we have a heart that pumps our arteries and veins, but our lymph is pumped by mobility. So hence when your chest is all tight, it doesn't flow properly. I want to unlock this joint a little bit more before any more side posture happens. This, right in here, nobody ever has surgery on this joint. This joint, again, sits on the sidelines and watches the football game and never gets a concussion. Nobody ever injures this joint. And when I was trying to adjust it, it was not moving, and just this was moving. And that's, no.
That's my SI?
I don't like it. I want this to be moving.
Yeah.
So I would rather spend, half dozen visits unlocking this until I can be assured that I can adjust this without upsetting lumbar 5 and lumbar 4. There we go. Sitting locks this joint is the main reason for why this gets stiff. That's what does this. Right in there. Okay. What happens is when I'm pushing on this joint, it's all going here. It won't move independently. What has to happen is you need I don't know how many visits. You need a level of care to make this looser, so that I actually can adjust it. At this point, maybe if I totally body slammed you and jump, I might be able to get it to move. Do you understand?
Yeah.
But only after I blew this up.
Right.
Oh, great! I just destroyed your lower back, and maybe I got your SI joint to move. Yay!
Right.
Good job.
Right.
I was I felt a bunch of water balloons in here when I was pushing. I was like, geez, why does it feel like I'm underwater throwing a punch? Do you understand?
Yeah.
It felt weird. Right there. Once you get that SI joint working, it's going to feel pretty phenomenal to have. You've lost a strong, player on your team there. One, two. That's it, no lower. You're saying nobody off limits. We're staying up here. But yeah, that knot right there.
It's so funny.
It's so obvious.
That's the spot.
It's so obvious. Look, this is nice and smooth over here. And I gotta.
It's funny because I don't drink caffeine ever, and I haven't in forever, probably since then. So I would have it every once in a while, but for 15 plus years I haven't, because even with the caffeine I would get spasms and it would always be right in that spot, like where I could feel the muscle just and then it would get sharp, but it's always right there.
Alright, I'm done. I'm just greedy. Just roll. Easy. Let's not load you. Put your weight on that joint.
Yeah.
Go easy. Lay flat on your back. Yep. Easy. Yes, perfect. Yep. Yes. Keep these bent.
Keep them
bent. Yeah, let that joint open up a little bit for a second. Just stay there. We're gonna give that a few minutes. Really jammed.
Should they all pop?
Yes, sir. Yeah, no, it's not that I don't need them to pop. I need them to feel like they're moving.
Okay.
Right? I got no separation of a metatarsal phalange joint here.
Yeah.
I should feel it like the piano keys moving.
Sure.
I feel no mobility. I have no separation. Nothing. You understand? I got no. What'll happen is this is what bunions, drop metatarsals, plantar fasciitis, shin splints, right? Those are all, to me, heel spurs. Those are all one diagnosis of too much weight here, because your thoracic cage is in the wrong position. The weight is going to shift to here. 70-80% of your weight belongs in your calcaneus when you're standing. It isn't on your calcaneus because your head's forward. The weight's here. When the weight goes here, the toes start to hammer. Bunions, all that sort of thing. These joints are getting jammed. Your first two joints here are jammed because there's too much weight on the toes. It's just a domino effect. I want to work on getting your toes back into a don't like that. We want to go this direction. Traction, curl, unlock. Okay. All right. The way to me we get up. You have two options. We got to either try rolling to your side push-up. The other way is going all the way back to your belly and then coming up on all fours, like a cat-cow kind of idea. You can go one way, you go on all fours, you understand?
Yeah.
And you come up slowly, and you try to start loading that joint up. You understand? So probably the safest would be, let's try going all fours. Let's go right, now we're going back onto your belly.
All right, yeah, I mean, usually for my back, it's not a problem. It's usually the other way. Hold on. Actually, wait, no. Yeah, it's usually the other way.
Now come up on all fours.
Yeah,
There you go.
easiest.
Now start to load the joint. Now you're gonna,
because that helps the most.
Now try to get exactly as you're coming up right here. Start loading the joint, load the joint. Yeah,
And then that's good.
right. Yeah,
Oh, wow.
yeah. That's a considerable amount.
Yeah.
That's that knot right
Right in that spot there.
there
Okay.
is the epicenter
Wow.
of your jam. This is all
Mhm.
jammed up.
A lot wider on that side than this side, too. Real narrow on that side.
It's
and then
pervasive.
really-
It's
yeah.
the whole thing right there.
Huh.
It's this. You're essentially you're grinding, like you're saying. You're in this position. You're grinding this,
Sure.
and you're popped out. So we have to actually do the opposite. We want to actually go back and left, because you're going forward and right. Go ahead and tilt your head left for me. Tilt left. Okay, a little bit. And go ahead and tilt your head left. Tilt left. Okay, it's okay. Sometimes we'll get a little click out of here. Try to bring your right ear to your shoulder. Yeah, just a little bit. All right, go ahead and tilt your head right. Okay, it's okay. All right, this is the same kind of rules are going to apply to when reloading that joint. When we get off this, we're going to have to again open the joint up a little bit. You're saying I'm closing again because we're trying to take the weight off the joints, but we're trying to loosen your middle back up here also. What we'll do is we're going to start in the middle upper back, and about every minute you're going to move down an inch. So you're going to roll towards me upwards, so push with your feet and roll. And we're going to start putting that, this guy's going to go right on that middle back knot. Get the idea? We're going to, so breathe, bend the knees a little bit more.
I mean, it feels like it mostly is on the knot now.
We're on it, okay.
Go farther down, right?
That's good, right? Stay right on it. This is what I want you doing in your office.
Okay.
Locking the door, and you lay down, and I got about this much material behind your head. Eventually this is gone and your head's just on the floor, even with this on that middle back.
Oh, really?
Let's try something. Let's feet together, knees together. We're going to real gentle. You're going to pick one side and bring your knees to the side. So you're going to rotate. You're going to rotate your knees.
Like that?
Yeah, breathe. Yep. Breathe. This is compressing the right. This should be easier. Let's go bring the knees back up now. Let's try that left. So move your feet right a little bit. Move feet right. There you go. And then knees left. Breathe. Here we go. Now we're going to compress that left side. Yeah.
Yeah, I feel a stretch along sort of thing.
Yeah, let that go easy. What I want is it eventually, should open that up a little bit down there, but I want the middle back to get some pressure. You're saying I'm working that knot on that left side, emulating an elbow, using a foam roller as an emulation. And knees back up about 5-10 seconds, and then keep the knees in the middle. Bring your feet back to the middle, and just stay in the middle for a second. Just stay there in the middle. Your range for this is going to be, up here, upper back, never down here. Chest, the whole rib cage is our goal. If you feel I understand if your lower back is already killing you, to get on this, but if anything's getting worse in your lower back, get off, move higher. If anything in the leg's getting worse, stop. go back to icing, back brace. You understand? What can happen is, even though we're pushing here, this can be moving. The more you're adjusted, the less likely that happens.
Mm-hmm.
As a new patient, we kind of idea, we got to be careful that it's likely and possible that it bends where I don't want it bending. Let's roll back let's go back the other way. We're going back up. Breathe, breathe. What'll happen is you stay in one spot too long, you're going to get stuck.
Mm-hmm.
Ed, help, I need a forklift to get me off this thing. Do you understand? So the first dozen times you do this, I want you every minute moving 1 inch.
Okay.
Otherwise, the danger of getting stuck, you're not used to having pressure on these areas yet. So as you do this more, you'll move less. You'll actually just do 20 minutes right on that knot, on that, trying to get pressure on that left side.
Sure.
And this is gonna divert the traffic away from the road that's got all the potholes. We're gonna divert the traffic down these other side streets and give that one road a vacation so it can actually get repaired. That ligament can heal slowly. It takes about a month and a half, 6 weeks, right, for that ligament to start calming down, assuming we stop poking at it. See how my neck is not bending? I'm not doing this. My back is now stiff, and now I'm bending too much with my neck.
Okay.
You see? My neck is not bending because my back is bending.
Okay. Got it.
And then this whole thing becomes a joke.
Okay.
My head's on the ground. I had you elevated because I'm worried you're going to bend too much in your neck. So we're limiting the depth. And over time, you'll start increasing your depth until your head's on the ground. You need a mechanic to put you back together if you're going to keep doing these type of athletic type things, which is what 15 hours of sitting is doing. It's just,
Okay. So do you feel like if I'm standing here like this and working standing, that's better or worse?
it's better technically.
Maybe.
I would have a back brace on, put a
Okay.
back brace on, because then you're less flexed. The closer your thigh is to your chest, the more lumbar curve you removed.
Okay.
It's about your chest to thigh angle, right? So when you're standing, it's be about standing desk. Yes, it's better. You're still flexed,
Right.
right? But this angle is 160 here versus 90, right? So that means you have less interdiscal pressure. I mean, it's like, should I grind my teeth like this?
Yeah,
Should I
or
grind my
like
teeth like
this,
this?
right.
That's basically the question you're asking me. I'm like,
yeah.
I don't want any grinding.
Right.
I think it's all bad, but yes, if you're gonna grind, do it gently, I guess.
Okay.
But just kind of gently push your teeth together. And I don't like the disc's injured. You just told me you have sciatica. That's a disc injury. Somebody needs to stop this. And the good news is, what I would love to show you if you have your MRI next visit, or I can show it to you. Look at all your uninjured discs.
Yeah.
Right? Yeah, you have this one down here. Everybody's so focused on this. But look, brand new, brand new, brand new. So you have a brand new teeth over here. We just got to unlock them. And you can live the next 50 years of your life. But it is impossible to use a disc zero. It's impossible to never chew on a tooth. You're gonna, or maybe you lose, like I told you not to chew on that tooth, and then I was chewing over here just like I told you, and then I forgot about it, I chewed on it again, it hurt. We're always gonna have to be aware of L5. We can't turn back the time more than about 5-10 years. So if you're 40 and your lower back looks 65, I can make it look 60 the rest of your life, but I can't make it look 20.
Okay.
I'm not Jesus. I can't heal that wound.
Right.
But what I don't want is by the time you're 60, I don't want it to be 100.
Right.
Then we're in wheelchair surgery. That's where the surgeries start coming in because there's no disc left and it's all damaged.
Right. All right. Thank you. Appreciate
Great.
it.
All right. Very good. Thanks.
You take care.